Right, well, welcome everybody to all of you who've joined this live event, and also to those of you watching a recording of this discussion. My name is David McCoy and I work for the United Nations University International Institute for Global Health. UNU-IIGH is the UN's designated global health think tank with a mandate to facilitate the translation of research evidence into policies and tangible actions. And in doing so, we work with a range of policymakers, academics, civil society actors, and various others. I'm delighted to be hosting this discussion with three wonderful people about a topic that is complex, challenging, and sensitive. So I'm going to begin by sharing my screen. And to introduce our three wonderful panelists. Firstly, UNU-IIGH, a senior fellow in the governance cluster at the Institute of Development Studies at the University of Sussex. Her current research interests focus on accountability and public services, gender and taxation in the informal economy, and governance in fragile contexts. She has experience of consulting for bilateral and multilateral agencies and has managed large multi-country research projects in a range of countries in the Global South. Marta Schaaf has spent 20 years at the intersection of health and human rights, engaging in research, advocacy, and program management. She currently leads the program on climate, economic, and social justice and corporate accountability at Amnesty International. Previously, she consulted for WHO and for the Office of the High Commissioner on Human Rights, on sexual and reproductive health, and has worked at Columbia's School of Public Health. Marta is also a parent climate activist in New York City, where she sees firsthand the influence that private actors have on population health and legislation. And then thirdly, we've got Alicia Yamin, a lecturer on law, and also senior fellow within the Harvard Law School and an adjunct senior lecturer at the Harvard School of Public Health, as well as being a senior advisor on human rights and health policy with Partners in Health. Alicia's career bridges academia and activism, and she's got extensive experience of work in Latin America and East Africa. Alicia has co-founded a health and human rights program in Peru and has also served on the UN Secretary General's Independent Accountability Panel for Women, Children's and Adolescents' Health. Alicia also frequently advises tribunals and legislative bodies globally on health and reproductive rights. A fourth panelist, Rajat Khosla, was due to join us but had to drop out. So it's basically just the four of us for this webinar. Now, the plan is that we're going to start off with a conversation amongst ourselves for about 30 minutes before opening up to questions and comments from you in the audience. There is a chat box where you can share your thoughts as the discussion progresses. And there's also a dedicated Q&A box for you to post specific questions to any one of us or to all of us on this panel. And please just remember to add your name and tell us where you come from. Now, before we start the conversation, I want to provide a little bit of background and context. The first thing to say is that this is the first in a series of 3 webinars that we're organizing to really publicly announce the beginning of a new package of work at UNU-IIGH on the theme of power and accountability. The details of the 2 subsequent webinars are listed here on this slide. And this all relates to, as I mentioned, a work package on power and accountability that is one of 4 new work packages that represent the building blocks of a new 5-year strategy at UNU-IIGH, a 5-year strategy with an overarching mission to reduce global health inequalities. The 3 other work packages are on gender equality and intersectionality, on digital health governance, and on climate justice and health. Now, another thing, obviously, is that this work on power and accountability is happening across a backdrop of changes in the system of global health governance. We know, for example, that there are all kinds of power imbalances and inequities within the global health system, and also that the multilateral system of global governance that emerged and has subsequently evolved following the Second World War is beset with many challenges, including the fact that the very idea of global governance is now facing a significant populist and nationalist backlash in many countries. So the topic of this webinar, which is power and accountability in global health governance, is not at all straightforward. And to help move us forward in our thinking, in addition to this webinar, we've also just published a working paper on global health governance and the challenge of holding power to account. Now, one of the features of global governance and its evolution over the past 4 decades of deepening globalization and a dominant neoliberal policy paradigm is that there's been various shifts in power. This includes shifts in power from national to global institutions, and also from governments and public institutions to private actors and to markets. So one of the focal points of our work on power and accountability is specifically on the role and impact of powerful private actors on global health. And this was the subject of an expert group meeting that we convened in Oxford last year, where we examined the role and impact of 3 particularly powerful private actors. First, the large and oligopolistic transnational corporations who are central to the commercial forces driving many non-communicable diseases and also central to the many barriers that produce profound inequities in access to healthcare. And they're also central to many of the potential threats and harms associated with artificial intelligence and the digitalization of society. The second group of actors are the private financial institutions, including private equity funds, hedge funds, banks, and insurance companies. These are the actors that lie behind the so-called financialization of society, a phenomenon that is actually not discussed very much in global health, despite the fact that this is a phenomenon that is having huge health impacts across the board in high, middle, and low-income countries. And then the third group of powerful private actors are the private foundations and the small number of private individuals with extreme wealth who are able to also use that wealth to influence democratic processes and public policy with very little in the way of formal checks and balances. So both this working paper and a report on this expert group meeting are now available on our website. So it's with this background in mind that we can now begin this conversation. I want to start with you, Anu. I want to start off by asking you to say something about how power, accountability, and governance relate to each other, and also about how global governance differs from national governance, and what are the implications of the difference for ensuring accountable governance. Thanks, Anu. Over to you.
Thanks, David, for that nice framing of the topic. The question you ask is a basic one, and I'm going to start with some very basic definitional things that we can then start to connect to each other. So at a very fundamental level, power is the ability or capacity to do something or act in a particular way, or to influence the action of others, as well as the capability of taking action. And generally, we can think of power in 3 kinds of ways, and this will become relevant as we move forward, as visible power, power that we can see as it's being exercised, invisible power, where actors have the power to shape agendas, decide who gets to participate or not, which is not exactly visible, and then hidden power, this power that exercises influence over the ways in which we think and conceive of the world. So these are different forms of power that are in play, both at national and global levels. On the other hand, governance, we think of as the processes, both formal and informal, through which public authority over various realms is created and then exercised. So it includes structures, systems, institutions, etc., in which public decisions are being made. In the case of accountability, obviously, governance structures shape the accountability landscape and the distribution of power within it. Now, accountability as a concept really is intended to be a way of controlling abuse of power. So you have powerful actors, they might act in ways that are not in keeping with, say, public interest. And that's the way accountability mechanisms are supposed to enable some control over this abuse of power. And this power, accountability mechanisms can be, the power itself can be delegated through, say, democratic processes, or it could be accumulated. So, gathered up by, for example, large financial institutions. And the idea is that accountability enables those affected by the exercise of power to have some way of rendering judgments and sanctioning misuse of this power. So accountability is normally seen as a relationship between those exercising power and those affected by it, or those having delegated power and then, affected by it. So this is what these three concepts mean and how they're related. Now, normally, we think of these concepts in relation to the national context, so the governance of public services. And here the governance relationships and accountability relationships are clearer because they're between the people and the power holders that rule them, the governments that rule them, either through democratic relationships on the one hand, where people choose leaders through voting mechanisms, or in undemocratic or authoritarian systems, in which even authoritarian leaders, in some sense, require legitimacy. And they create this legitimacy either through some bargaining between elites and some ways of getting consent to rule from populations. So because if you don't have that kind of consent to rule, then you have constant conflict. So this is the way you would think of accountability of governance and governance in the national context. However, once you move to the global context, things are different because we don't have a global government, a world government. Instead, global governance includes a whole range of diverse institutions, including intergovernmental organizations, specialized global agencies such as the WTO, multilateral banks. There are treaties such as the Universal Declaration of Human Rights, but there are also bodies of sort of peer volunteer bodies such as the Open Government Partnership that work on norms and peer influence. And of course, as David mentioned in the beginning, there are powerful transnational and national economic actors that are also influencing these governance institutions. So global governance is different because this direct connection between the powerful institutions and the affected populations and institutions, particularly of the least powerful groups, is not direct or clear. So in terms of accountability, what does this mean? This means that the diversity of global governance institutions, accountability is fraught with ambiguity. What standards are meant to apply? What is the criteria of judging what actions are reasonable or unreasonable? Who is to be accountable to whom and for what? The long and very weak chains of accountability make it difficult to ensure that outcomes are in the public interest. Second, despite many nation states being signatories to or members of these global governance institutions, two problems loom large. As I said earlier, many national governments do not represent the interests of all their populations. They might be authoritarian, self-interested, or even captured by powerful economic interests. And on the other hand, we also have nation states that might be truly democratic and working towards the public interest of their populations, but power differentials means that they're not in a position to influence at the global level. So, this is another problem. The third problem is because global governance institutions don't have clear lines of accountability and multiple accountability relations exist. to the countries, to the funders, to the global health community, to populations. And when you have these complex webs of accountability, powerful actors can exert oversized influence at the cost of accountability for the interests of the least powerful groups. So, for example, conditional funding of work of global institutions by private foundations can skew outcomes in particular directions that might not be in the broader interest. In the health field, these problems obviously have become particularly acute because of the global health crises, such as the pandemic, which actually do require global responses. So we require thinking at different levels when you're thinking about global accountability and global governance, both at the global level and what's happening there, but also at the national and local levels, because actors will be playing at different levels. And health is just one part of the global governance system. There are other global governance actors that influence what's happening in the health system. So we need to think about those as well. And we also need to think about individuals as well as institutions and as well as systems. So all three things need to be thought across at the same time when you're thinking about global health governance. And just to end with a couple of last points, I think in this landscape, the first step we have to do is to unpack the way power is held and wielded by these different actors and institutions. Why is it that some global actors are escaping accountability? What are the visible, invisible, and hidden sources of power that are coming into play? What does the accountability ecosystem look like? And who's influencing whom through what channels? Obviously, these questions don't have easy answers, and that's why there is a research program that's starting at this moment. And power and political economy analysis are useful tools in this endeavor. Ultimately, I think the task is to identify and strengthen the hands of pro-accountability actors within the global health system in order to tackle the unaccountable systems that exist. And part of this is to build diverse coalitions, including governments, social movements, global institutions, that we might tackle this unaccountable takeover of the global health governance system. And this will necessarily include new framings of problems, a new moral economy of narratives that has to prioritize public health over profit taking and self-interest. I'll stop there.
Thank you, Anu. That's a wonderful introduction to the conversation about the challenges and in particular the democratic deficits that exist at the global level of governance. Alicia and Marta, any reflections on this point about governance at the global level? Alicia, you want to go first?
Well, in terms of global health governance, I thought I'd pick up some of the things that Anu was saying and then dive into a more elaborate discussion of the definition that we have decided to use for global health governance, which has many definitions. It's quite a contested terrain, and by choosing a definition, we are in many ways, revealing certain ethical commitments of our own. So global health governance has been defined as a system. It's been defined as an architecture that focuses on the institutional structures. Others, as some of Anu's comments made clear, pick up on the mixture of informal norms as well as formal norms and processes, an agency of different actors within this whole kind of plexus. So I'm going to read the definition that we have chosen and then kind of unpack it a little bit. We define it as the formal and informal structures, systems, and institutions through which actors make decisions about global health standards, policies, and priorities. 2, finance, organize, and implement global health initiatives, programs, and plans. And 3, influence and engage with actors, systems, or institutions that lie outside the health sector but impact on health. So that essentially has 3 different elements. We talk about governance within global health. So this is how the World Health Organization, for example, is governed, which would be enormously influenced by the new structure of financing through replenishment. There is a second layer or concentric circle of how the entire ecosystem of all of the institutions that sort of work on global health are governed, which would include, for example, UNAIDS and Gavi and the Global Fund, as well as the World Health Organization and UNFPA, all of those institutions. And you might add also regional health institutions like that are also involved. But a third larger concentric circle or dimension are all of the institutions that are not necessarily actually global health institutions, but intersect and deeply shape this this governance frameworks and rules. And they include the Bretton Woods institutions, the IMF, the World Bank, the World Trade Organization that Anu mentioned, and many others. There's an enormous kind of scaffolding of global administrative law with different institutions of investor state, dispute resolutions, et cetera, that affect very much how states can protect population health and what the standards and norms are at the global level. So our definition also then looks at this quite broad descriptive definition of global health governance, but then injects a normative element of what is good governance. And there I want to pick up on what Anu was saying about accountability and justification to the people who are affected by these policies. And I think she laid that out quite well. So I will say, as a human rights lawyer that has been doing human rights work on health for many, many years, the shifting nature of global governance from what Anu described as public institutions making decisions to what David hinted at as the growing influence and power of private actors, transnational corporations, private financial institutions, and also philanthrocapitalists and private foundations, has an enormous influence on whether governance is good and accountable. From human rights, we have focused very heavily on curbing arbitrary or discriminatory use of power by governments. But this shift in governance and the concomitant shift in financing that is given far more resources to these powerful private actors requires a change in strategy to look at how the rules of the game, how the agenda is being framed, as Anu said, that agenda framing invisible power that is exercised in a very complicated and way that is not always easy to draw lines of causality and responsibility for, which is the way human rights creates accountability. So this requires new strategies from the advocacy groups that have always tried to rein in governmental power in different ways to advance population health. And that's, I think, one of the great things about this working paper series and the conversations that we're having and that we want to invite other people to join in on, of thinking through what kinds of transformative praxis we could engage in future to shift these evolving new power dynamics where private actors hold so much sway. And to just end on the role of law. As Anu emphasized, a political economy perspective is absolutely essential. Often we think sometimes in human rights law, and sometimes people who are not lawyers think, well, the neoliberalism has sort of evolved as though it were separate from the legal enabling factors that have allowed it to evolve, right? What we now see in terms of global health governance is the product of changes in intellectual property law, changes in antitrust law, changes in tax law, changes in financial and banking regulation. So all of that has to do with shaping the power and accountability of private actors. And I'll stop there. I'm looking forward to the discussion. Thank you very much, David.
Thanks very much, Alicia. There's a lot to pick up on, but let's just move to Marta now, who I want to ask, to help us unpack this concept of accountability. It's a word that we all use, and most people will talk about accountability as a good thing in principle. But what does it actually mean when it comes to global health governance? And what are the constituent parts of a system of accountability or an accountability mechanism?
Thanks, David. And I'm going to try to complement the excellent comments that Ali and Anu already provided. And in my response, I'll provide the response from the background paper as Ali did, and kind of signal in a few points where some of the challenges arise. I think what's important to note at the beginning is that accountability on the face of it is a neutral concept, just like governance, right? It exists. It doesn't mean it's a good thing. And I think often there's a conflation between governance and good governance, and accountability for something we care about and accountability for something we think is negative, right? There's a lot of accountability in an authoritarian system or in organized crime, but that's not what we are seeking to discuss today. Is precisely what Ali said, is a discussion about how we can work within the current context to change the power relationships towards an end that is accountable for the public health starting with the most vulnerable groups. So in her definitions that she provided in the beginning, Anu explained that power is about a relationship, essentially, right, between the governed and the governed, or the governor and the governed, or between, in the language of human rights, the duty bearer and the people. In the paper, we define accountability as comprising 5 elements. It's not super exciting, so I ask you all to stick with me as I go through some of these, and then I'll try to signpost again where it gets complicated. These 5 elements are standards, data and information, answerability, sanctions, and remedy. And these are, in using these same terms or in different terms, are all pretty common to many definitions of accountability that are prevalent in political science and the legal literature. So when we talk about standards, we're referring simply to the yardstick against which performance and/or conduct are measured, right? So this could include laws, it could include guiding principles, it could include national policy goals related to, for example, universal health coverage. The second element relates to the concept of transparency and the availability, accessibility, and understandability of data and information that can be used to assess the performance or conduct of an actor or institution. So to go back to the universal health coverage example, we would want data on the extent to which individuals are protected in the case that they're unable to pay for care, they have the care is physically proximate, the care is culturally appropriate, et cetera. And these data and information should be available in the languages that people speak in an understandable format, right? So not in convoluted Excel spreadsheets that few people can understand, and so on. The third element is answerability, which refers to the requirement for duty bearers to respond to retrospectively or prospectively, so in advance or after the fact, to questions about their decisions, actions, or impacts, right? So again, in the context of universal health coverage, why do we decide to have this type A of a health insurance system? The fourth element is some form of sanction or a credible threat of sanction in the event that an actor an individual or an institution fails to meet the expected performance or behavioral standard. So we can think of hard sanctions such as a financial penalty or criminal prosecution, or something softer such as loss of reputation, right? So a political party, in the classic example of a democratic political system, the party loses after they failed to meet the objectives they said they were going to meet. And the last element is remedy. And so this can take the form of restitution, rehabilitation, compensation, so financial payment, and corrective actions to prevent the problem from occurring again. So Anu in her answer spoke about many of the problems with this framing in the context of global governance, right? Where we have very long, weak chains of accountability. We have power differential both within and among countries. There's no world government. We have multiple accountability relations, right, that may act at odds with each other. And in this context, powerful actors can exert outsized influence. There are authoritarian governments that may not be acting in the interests of their own people or any other people, but simply out of self-interest, and so on. So these all pose challenges to this very sort of taxonomic approach to accountability, right? We can go through and systematically think about where all the challenges arise in each of those 5 elements. But it may also be helpful to understand the breakdown and the accountability mindset that happens in this context, right? So theorists on the more constructivist side of social science have offered some normative approaches to understanding accountability that are focused less on these 5 elements, but that look at how norms evolve to reflect an accountability mindset. So you can think about this on the national level in terms of service provision, or on the global level. And so they might explore how professional or social norms favoring accountability can engender compliance, irrespective of what the formal rules are, and how these norms can be nurtured, right? Going beyond the notion of disembodied rules and a rule-making solution to an accountability vacuum problem to promote a more responsive, transparent, and democratic service delivery culture, both at the national level, but we can think about this in the context of global health governance, where there's a purported interest in promoting the public health transnationally. So this can sound really complicated, but to turn to an example, you can imagine a situation, let's say a global level policymaking process with very well-defined rules and regulations regarding conduct and transparency. But it is presumably easier, as many of us I'm sure have witnessed, for corporate actors to game those rules than it is for civil society to game the rules. It will be presumably easier for them to limit what's on the table for discussion in advance of the well-governed event by meeting with or otherwise exerting subtle pressure on governments and negotiators. For their part, national negotiators might feel compelled or directed to respond to political pressures emanating from their home countries. So in this context, the social license of a given corporate interest matters, right? So when we think about the outsized influence that Anu and Ali described, they need to have some legitimacy to be able to exert that influence. So arms dealers and big tobacco are routinely excluded from WHO spaces, for example. And this is supported in the culture of negotiations where actors might feel embarrassed to argue on the behalf of these constituencies, although of course they may do so to some extent. This is not yet the case for big pharma or for fossil fuels. So we need only to look to the negotiations for the pandemic treaty to find a recent example where discussions regarding the WHO pathogen access and benefit sharing system, which was going to govern the access of lower income countries to vaccines and other essential commodities for fighting the pandemic, have resulted in compromised texts where a relatively low percentage of pandemic-related health products are guaranteed to the WHO in the event of a pandemic, leading to the near collapse of the treaty negotiations. So I think I can end there, but I have more examples as folks are interested in as we progress.
Great, thanks, Martha. So just to encourage the audience to post questions to any of us on the panel. But I just want to pick up on this notion of good governance. We explain that when thinking about governance, we've got to qualify and determine what we mean by good governance if we want to improve governance. And I knew you talked about, there being some kind of, in our definition at least, some kind of adherence to democratic values or principles whereby those with power and the authority to govern are accountable to some degree to those who are being governed. But another dimension of good governance that we discuss in the working paper is the idea of checks and balances within the system of governance itself. So we talk about good governance as being governance where no single actor has all power, and that there are built-in systems of checks and balances. For example, separation of powers between different organs of the state, between the judiciary, the executive, and the legislative bodies of government. And we also talk about the importance of social institutions and norms that can help to ensure that governance is good. Here we talk about a free and independent media or press. We talk about the existence of a healthy higher education sector that are mandated to inform the public, to conduct research and evaluation of powerful actors in society. And we also talk about, good governance being associated with a healthy civil society, willing and able to represent the interests of the least powerful in society, and willing and able again to hold power holders accountable. So one of the questions is, do we have this kind of system of checks and balances and a healthy social, a set of healthy social institutions at the global level to ensure that we have the kind of governance that we consider to be good? I wonder if any of you would like to comment or reflect on that.
Well, I guess I can begin. I think historically, obviously, the global governance has never been truly democratic. The global institutional order that we know of today was established in part after World War II with major institutions of the Bretton Woods institutions and the United Nations, and then has been modified over time, and probably particularly in the 1990s. And in the 2000s, there were important changes to global health institutions and governance. And that was never really democratic, right? Even the United Nations was never democratic when the United Nations started. Sub-Saharan Africa was still under the shackles of colonialism, etc. There were a lot of voices that were missing from the Universal Declaration of Human Rights. And the United Nations, there's a very big difference between the General Assembly, which is one country, one vote, and the Security Council, as we've seen in current times. And over time, of course, the Bretton Woods institutions and the World Bank and the IMF have taken on outsized power over global governance, which is largely unfettered and unaccountable. But even so, those multilateral institutions and the way global governance functions has been greatly affected by this sweep of neoliberalism, where tax revenues have been in decline. So there are, for example, fewer assessed contributions to the World Health Organization, and far more in recent years, since about 2000, far more voluntary contributions for defined projects. That change and that recursive relationship between what happens at national level and how global governance functions is quite dramatic, because then global institutions are not necessarily just agents that are acting out even these powerful governments' interests, which again is not democratic. They are really doing the bidding of certain private actors who are completely unaccountable. So I think not only, in my view, do we not have a proper system of checks and balances, but the initial flawed premises about the kinds of principal agent accountability that would be exercised through nation states and indirectly through the subjects of nation states no longer hold.
So, Anu, do you want to?
Yeah, I wanted to make a couple of points in relation to that as well. Thank you, Alicia. That was very useful. I think also the problem at the global level is the kinds of checks and balances that you were talking about, David, at the national level. We just don't have them as strong or as significant players. For example, media is not as powerful at the global level as it is at the national level in influencing decisions. Civil society, we know, has very limited access to some of these spaces. And social institutions and norms. I mean, one of the things it strikes me is that fundamentally, to make some of this global governance more accountable, we have to shift the acceptable norms of what is possible at the global level. So, for example, neoliberalism has made it okay to make profit over everything else. And we have to have a sort of shift in norm, which says, well, actually, no, what matters more is people's lives and their health and well-being. And then, profits can be a second step. And that's not the norm that's currently in vogue. I'll bring an example from India, which is not related to health necessarily, but it's about the right to food case in India, which some of you might already know, where a group of activists brought a case in the Supreme Court saying that you must be no citizen should starve under this government if there is food grain available. And that was not in relation to any formal accepted law or anything. It was just to say that people can't profit while people are starving. And this became an accepted norm. So it's not that norms change overnight, but it is possible to change them, and that's what we need. Sorry, I went off on a little bit of a rant there.
No, not at all. Thanks, Anu. And I wonder if I could ask you, Marta. I mean, you work for an international NGO and have done for some years now. I mean, what's your feeling about how healthy international or global civil society is at this moment? And has it got stronger or has it got weaker? What's your feeling from your Amnesty International perch?
I don't know if I can answer the stronger or weaker question. I'm sure we're all aware of the increasing turn towards authoritarianism and criminalization of protest in many different contexts at countries at all levels of income, right? And that has an influence, and it means that it is taking out of the equation some of the voices that would be most critical of this turn to neoliberalism that we've been describing. I think, with the Commission on Macroeconomics and Health and the Commission on Social Determinants of Health in the early 2000s, there's been this increasing recognition within the global health space that we need to talk about processes that occur outside of formal health contexts, right? As places where decisions about health are in fact made, and we make that argument in the paper, right? The global governance for health isn't just about WHO, it's about WTO and Bretton Woods institutions, et cetera. But despite this recognition in certain spaces that the determinants of health go well beyond the health sector, there are so many things that aren't on the table. And so this is a result of the corporate capture that my colleagues have and you have described. And it's also a result of, to some extent, the capture of civil society, right? We have actors who are very powerful, be they foundations, corporations that are involved, and private and stakeholder partnership organizations in global health, whose stated purpose is the public benefit, whose stated purpose is to work on global health, but who exercise in some way an almost monopolistic control over what is on the agenda in global health. And this means that in some, I mean, I don't want to over-argue the case, but that it undermines the acknowledgement of some of the very essential social determinants of health that we're facing right now, at the same time as civil society is being, power is being threatened by changes in the political economy and the legal situation within countries, as well as globally, right? So, for example, at the most recent Conference of Parties on the UN Framework Convention on Climate Change, so this was the one held in Dubai, there were 2,456 fossil fuel lobbyists, and there were challenges in civil society access, with many activists unable, of course, to afford flights, et cetera, visas, these same problems that occur in global health conferences as well as intimidation of indigenous peoples, restrictions on access to space that were new, restrictions on protests that were new, and as sort of subtly evolving context that makes it harder and harder for people to speak out about the harm that fossil fuels are causing, while at the same time, a process that is more and more amenable to fossil fuel influence and mis and disinformation and control over the negotiations. There are many examples of this. We have the WHO Foundation, for example, to build on Ali's point about project-specific funding. There's also the WHO Foundation, which is created to funnel money to WHO. 11 of their $16 million in income last year were from anonymous donors, and most of the remainder is from tech and pharma. So these are things, I mean, we don't need to be conspiracy theorists about it, but we need to pay attention to what's happening and think about the influence that this subtle corporate influence over decision-making spaces and civil society spaces, and spaces that on the face of it should be led by governments, and should not be more amenable to corporate actors than civil society, are increasingly more amenable to corporate actors than civil society. And so in public health, we often look at the example of tobacco or arms as something that we've taken out of the equation. I think for many other issues, it's moving in the opposite direction. There's been very little progress.
Thanks, Marta. I'm just looking at some of the questions that have been posed, and trying to kind of interpret them as well. And I think one of the themes that's coming through in the questions is about this relationship between power and accountability. That I think, as we describe in the paper, that accountability systems are often a reflection of how power is distributed across society. And at the moment, what we seem to have is a high level of concentration of power in certain states, but also amongst certain private actors. And speaking to some of what's being put on the chat, I wonder if we are seeking to find solutions for governance that is more accountable, do we need to also find solutions to redistribute power, whether it's redistribution of power between different regions, between Africa and the global north, for example, but also between these very powerful private actors and public institutions or ordinary people, wherever they live. I just wanted to get your thoughts on this relationship between the distribution of power and the way in which we can promote or propose solutions to make governance more accountable. Anu, you want to start?
So I have two reflections on this. One is, you're right that current accountability mechanisms, which are really in deficit, to be honest, reflect the power distribution at the moment. But in theory, stronger accountability mechanisms actually make the powerful accountable. And there's always going to be differences in power. So strengthening accountability towards the kinds of things that you want to see is an important step on the one hand. On the other hand, my reflection is that, the powerful actors currently unaccountable, particularly in the private sector, we are not necessarily using the levers we have to make them less powerful and not create the monopolies that they have over, say, large pots of money, finance, their interlinks between financial institutions, consultancies, the whole network or a cabal of institutions. And some of the levers we do have, we're just not using them properly. For example, tax is one of the big levers that we can use to reduce the power of these actors, but also orient them towards the goals we want them to have and not just be profit sharing. So I think we should sort of look into those sort of slightly sidestepping direct attention to global health governance, but looking at these other things we might be doing.
Yeah.
David, can I jump in?
Sure.
So I absolutely agree with Anu that we need to use the tools at our disposal more assertively. And many of those tools at the national level in some places do exist. But to pick up on the example of tax, I think it's incredibly important to go back to something she said earlier about focusing on the rules of the game. So there is now a very important proposal and initiative on the table to have one tax rate for these transnational corporations. That is an incredibly important potential change led by the African group, because these transnational corporations avoid paying taxes in the places where they're extracting money and resources from. And they locate the subsidiaries in tax paradises, et cetera. So just to have multinational, transnational corporations pay one tax wherever they are would be a huge shift in power. Similarly, I work at Partners in Health. We have been involved in debt restructuring legislation in New York State, which again, the proliferation of private creditors in sovereign debt issues is just extraordinary over the last 20 years or so. And New York State, as well as the UK, are the two jurisdictions where most of the restructurings are worked out. So just shifting the rules around how these restructurings happen and what rights are accorded to the debtor nations would be, it's a huge uphill battle. Most of this legislation is likely to fail actually today. There may be a piece that's saved, but just shifting that narrative and shifting those structural rules of the game is incredibly important going forward.
And I guess this comes to the point about the global health community having not just a mandate, but also responsibility for adding its voice to these proposals around tax and debt restructuring, etc. I mean, so we also have to hold ourselves accountable for what we work on and what we choose to ignore. Marta?
Yeah, just to say, having worked some on the legislation that Ali's describing in New York State as a New York resident, and also on a problem we're facing in amnesty, is the difficulties. I think one of the nuts to crack is the difficulties inherent in where the power is held and where the jurisdictions are where the power is held, and building literacy and interest in those jurisdictions about the need for change, right? So pharmaceutical companies exerted outsized influence in the pandemic treaty. There were also governments who were terrible and supposed arguments about sovereignty, et cetera. But the pressure for change needs to be coming from, complemented by powers in high-income countries, right, that are saying, yes, we also find this situation to be unacceptable. And it gets to some of the norms points I was making earlier, right? The sort of discourse about what is acceptable needs to shift. And I think within Amnesty, we're working on fossil fuels. It's quite challenging because so much of the harm of climate change is in low-income settings. A lot of it, not all of it, of course. And then building the power to demand change in the high-income settings contributes to feelings of insecurity among those who realize that their lives or their livelihoods depend on the current distribution of power. And we can argue about how it's not as extreme as people think, but we need to grasp with that at the end of the day, right? And it's the same thing if we look smaller in the context of global health foundations, right? Where so many of the jobs associated with those foundations are in high-income countries, and with the NGO, the sort of Beltway Bandit NGO infrastructure, and what redistributing power looks like. And this is something that folks in the decolonization movement are grasping with on a daily basis. So having a real discussion about the redistribution of power is essential to that. And it can't be won just with scientific arguments.
Yeah. Great. Thank you, Marta. We're 3 minutes to the hour, so we've come to the end of our conversation. I really just want to stress the point that this is really the beginning of a conversation that we hope to stimulate and catalyze right across the global health community. I would really love to hear more from people in this audience, people watching the recording of this conversation, to get in touch with us, to share your thoughts, your views. We have a second webinar coming up in 3 weeks, and I just want to share my screen again to indicate to you who we will have on the next panel. We've got a fantastic panel, just as we have had today. We've got Chi-Yok Ling from Third World Network, Suri Moon from the Graduate Institute in Geneva, Sharifa Sekalala from the University of Warwick, and Peter Singer, who's recently retired from WHO. So a fantastic panel to kind of build on the conversation we've just been having today. And to perhaps just unpack a little bit more about how we navigate the complex system of intergovernmental organizations, the complex system of multilateralism that's developed and evolved, particularly under the dominant neoliberal policy paradigm, which has seen these shifts of power, but also seen the emergence of new structures of governance, and in particular multi-stakeholder forums, and this proliferation in public-private partnerships. So we're going to be unpacking all of that in a little bit more detail in the next seminar. So do join us, do register for that second webinar. And all I have to do now is to just say thank you very much to you, Anu, Alicia, and Marta. Thank you to the UNU-IIGH team for organizing this webinar, and thank you to all of you who've been joining us for this live session. Go well and have a good rest of your day.